how to diagnose and treat malaria in multiple sclerosis patients. And this is part 6 of a several-part series on really understanding the role that malaria can play in the disease of multiple sclerosis and possibly other diseases also. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion, and I'm the founder of Live Disease Free. And this topic is very important to me because I was diagnosed with multiple sclerosis over 35 years ago. And by the grace of God, I learned early on that MS is an infectious disease caused by a parasitic infestation. So over the 35 years, we've learned a lot about the various different types of parasites that are really involved with multiple sclerosis. We know about, it started off with Candida, and then we learned a lot about Lyme disease. And then after that, we learned a lot about larger parasites that are involved, like larger roundworms and tapeworms and intestinal flukes and things like that. So I came across a lot of research, at least 75 studies, where in the late 1800s, early 1900s, a lot of researchers were treating MS with, or I should say doctors, they were treating multiple sclerosis with malaria drugs, quinine, hydroquinine, and they were having a lot of success with their patients. And so that really tweaked my interest. And so I've been doing a lot of digging, and there's so much there. I've broken it down into like 6 parts so far to really help you to understand, like, why did they think that MS could be linked with malaria, that why malaria could be causing MS. And again, there were doctors treating multiple sclerosis in the early 1900s, like 1932 to 1935. One Brickner, a researcher, his name is Brickner, and he treated 49 patients with MS. He concluded that treating MS patients with anti-malarial drugs like quinine was really, really helpful. I shared a case study last week, so make sure to go through all of that because there's a ton of evidence linking malaria with multiple sclerosis. So today we're going to talk more about the diagnosis, because we're not like a malaria patient. It's not like we have an acute case of malaria. We have, if we do have malaria and we have multiple sclerosis, it's more of a chronic state. We were exposed a while ago, years ago. Our immune system has not been able to clear it. Very often these parasites move into the central nervous system. And so it becomes a chronic, silent infection, which I definitely do talk a lot about, these different chronic silent infections. So there's a lot of different things to consider when we are looking at diagnosing chronic, and we call it cerebral malaria because it can be found in the brain. And again, it's chronic and silent. And I guess one of the big problems is that the researchers, the doctors, they're not able to pick up these chronic infections because they're not able to pick up the antibodies to malaria in our blood. They're not able to detect the malaria parasites. It's very difficult to detect them. And so some of the researchers were saying, I had an MS patient and he died, and then they do the examination on the patient, and that's when they found malaria parasites in the brain pouring out or moving out of small blood vessels. But before, they had no idea that this patient had malaria. And so our tests are poor. They're not, and we're not even looking for malaria in MS patients. So that's another big problem. We're not even looking for any infections that would cause multiple sclerosis. So that is a really big problem. If we're just focused on suppressing immune function, then we're never going to find the cause of multiple sclerosis, which exact parasites are causing it. So let's first talk about something that I found really interesting. Please type all your questions in the question box as I'm talking, but I wanted to bring your attention to something called blood lactate in multiple sclerosis. And so there's been quite a significant association with elevated blood lactate which is like lactic acid in the blood of MS patients. One study found they looked at 625 controls, so those would be healthy people, and 613 MS patients, and they found that lactic acid in multiple sclerosis patients in their blood was almost 3 times higher than in the controls in the healthy people. So like 300% increase, which is a lot. And let's talk about what that is. So basically, maybe you exercise and you know that if you work out really hard, you get stiff muscles the next day, and that is a buildup of lactic acid that hasn't been cleared out. If we have multiple sclerosis, then we don't process the lactic acid very well. But so our muscle cells and our red blood cells, they will produce lactic acid, but it's all in balance where normally our body will clear out the lactic acid. So we don't end up with a state where it's like lactic acidosis. But there are certain microbes that can cause different types different types of microbes that can cause excessive buildup of lactic acid in our blood. And we know that, for example, bacteria, like if there's an overgrowth of certain bacteria in your intestines, and also certain species of candida can produce a lot of lactic acid, and probably other parasites. But we know that malaria will really produce a lot of lactic acid. So some of the symptoms, you might find these quite interesting. Early symptoms of lactic acidosis. Okay, so these are early symptoms. So like when we have multiple sclerosis, if we have malaria, it would be more chronic. But maybe if we were ever first, exposed to malaria, and yes, malaria is present in Canada, in the United States, and in all countries, just it's more endemic. It's not large amounts like in other countries. So things like nausea, vomiting, extreme fatigue, muscle cramps and aches, and deep, fast breathing. More advanced symptoms could be feeling like delirium, confusion, loss of muscle control. So this would be more along the neurological conditions that would have chronic malaria. So we might have some like loss of muscle control and poor balance, poor coordination, trouble walking. And it could be in our fingers, our hands, our arms, legs, body, speech, and even eye movements. So we would have more neurological symptoms in this case. It can also affect our urine output, the flow of our urine. It can decrease it. And then also low body temperature, low blood pressure, fever, jaundice. Jaundice I found really interesting. So this malaria parasite can impact, or I should say the lactic acidosis can impact our kidney and liver function. So which cells are affected by malaria? Well, that's another. So when you start looking at all this, you just see the similarities with MS. And am I saying that all MS is caused by malaria? I can't say that. I don't necessarily believe that. I believe that it's probably one of the main parasites that we get, and we have a chronic state, and it suppresses our immune system, and then we're more susceptible to other parasites. Candida becomes a problem and things like that. But when you start looking at all the similarities, like how this lactic acidosis is so common in multiple sclerosis, and where malaria parasites really will produce excessive amounts of this. And I just wanted to go to here we go. So I just wanted to share a little about, so in malaria, more lactate is produced and the clearance of lactate, so that lactic acid is impaired. And so this increased lactic production might have several different origins, but basically when we have the malaria protist parasite and it infects our red blood cells, those parasites, they need glucose, and so they are literally breaking down, digesting glucose so that they have energy. And this is why the live disease-free diet is so incredibly helpful, because malaria, but also candida and all bacteria and worms, their favorite source of energy is breaking down glucose. And when they break down glucose, they produce a lot of lactic acid. And then we end up with all kinds of different symptoms like muscle spasms, and I mentioned them already. So I'm going to create a blog post like I do every week. It'll be on our website, livediseasefree.com. And you can read my notes there. You can go to different links if you're a science buff and you want to learn more about this, or you can watch the video while you're making supper. I'll have the condensed version of the video minus the Q&A, just tightening it up a bit so it's more concise. But we always release them on Fridays at the end of the week. So make sure that you're on our email list so you'll get the newsletter with this blog post. So let's go back up here. So the malaria parasite, it suppresses our immune system. It's known to cause a lot of inflammation, and inflammation is involved with all diseases. And it also, and I mentioned too that other microbes can produce the lactic acid also, very important to note. So what parts of the body are affected by malaria? The brain, the eyes, the retina, but also it can cause optic neuritis, the gastrointestinal tract. And so like if we have more acute malaria early on, it'll be affecting more systemically throughout the body. And then if there's more of a chronic case, it can be in organs, but it will also move into the central nervous system, and it's called cerebral malaria. But it can affect the gastrointestinal tract, the GI tract, lungs, kidneys, also placenta. Those are the organs that are specifically affected during and even long after a malaria infection. And so the problem is that some people, they might be exposed to malaria through mosquito. They might show a lot of symptoms, or they may not show very many symptoms. And some people will clear it, but some people won't clear the infection. And I believe it has a lot to do with dysbiosis and how out of balance we are with our microbes. Let's talk about some symptoms when malaria is in the brain. So this is where we're looking at a lot of neurological symptoms. And it's not just like movement, but it's also our mood and our like psychosis, for example, like affecting different types of mental health issues. So when you have red blood cells, and we'll talk more about the lab tests for it, but you'll end up they're infecting your red blood cells. So the parasites are infecting your red blood cells. And then once those red blood cells are infected, they're not going to be healthy, and sometimes they're larger in size. But anyhow, they're going to die, and they are not going to function well, and they will block certain vessels. And when they do that, you can get hemorrhages. So that means a broken blood vessel because it can cause a blockage. And so there are different symptoms, the neurological symptoms. There are different nerve palsies, so cranial brain nerve palsies, mellitus-like syndromes, psychoses, ataxia. We talked about that already, where we have poor coordination. We can have loss of, I just want to go back to it because there was a lot of different things with that one. So with ataxia, loss of muscle control in the legs and or the arms, lack of balance, coordination, also eye movements, legs, hands, arms, speech. It can affect your fingers. It can affect basically a lot of muscle control, and that's the ataxia. So again, those are symptoms. And then peripheral neuropathy. So a lot of our students that we work with, they have neuropathy, seizures, psychoses, agitation, impaired consciousness, coma. So it all depends on the parasitic load. If you have more of a chronic, then obviously we're not going to go into a coma. But if we have more of the chronic, then we will just have different symptoms, as I mentioned. Also, malaria can, when it returns, so like if we didn't totally clear it and then we kind of get relapses of malaria symptoms, we can have chills and hot flashes and sweating. So this is another thing that women think that it could be hormones, but actually there are many different parasites that can cause these hot flashes. And once they treat the parasites, then they don't have the hot flashes anymore. So there is something called a post-malarial neurological syndrome. And that is basically when it's defined by occurrence of neurological symptoms or psychiatric symptoms, so mental health symptoms, after the symptom-free period. So it's kind of almost like MS, where you get this relapsing remitting. So you might have, you don't know you have malaria, but maybe you just had a fever and you started having some chills and like you just thought you had the flu. And then you get over it, and then all of a sudden you get some, like as the parasite moves into the central nervous system, then you get this relapsing within 2 months after you think you're cured from malaria. And that is even like if you're having those neurological symptoms, they might do a blood test and they're not going to find the parasites, and they're not going to find maybe even antibodies. Maybe they would find antibodies yet if it's only 2 months after you had a malaria infection, but definitely they say that you might have a negative blood smear. So the parasites are not easy to find. So with blood work, because we're going to wrap this all up at the end, but with blood work, remember that these researchers, doctors that have been working at this in the late 1800s and the early 1900s, and then it just got dropped, really unfortunate. But they said it's really hard to find parasites, these protist malarial parasites, in patients that have a chronic silent infection. So if it's acute, if they just got bitten by the mosquito the first time and their immune system is just fighting and they get tested right away, they can find that. And it's the same thing with Lyme disease. It's very similar. And so the problem is like if we want to get our doctors to actually see if we have malaria, by them doing some blood work, if we can talk them into it, that's not going to be helpful. And then also looking at like the antibodies or looking for parasites, either way. So it's really important. What the researchers that I've seen is that if you start treating, and how we would do it, I'll get to that at the end of my talk. Let me just finish the different types of blood work things that we could see. So our red blood cells can be affected. So if you've had your blood work done, basically a comprehensive panel, and you've noticed that you have higher values or your test results are higher for MCV, MCH, MCHC. They can be higher in different species if we have different types of malaria protists. Anemia is common, and these parasites impact our T and our B cells. And it's interesting because, like with multiple sclerosis, our neurologists are telling us that, oh, your B cells and your T cells are going into the central nervous system for no reason and they're attacking your myelin. Well, I don't know about that. Maybe because if the B cells are activated when we have this chronic malarial infection, and again, I'm going to bring it all together here, but just be aware that your B cells can be activated. T cells are also impacted. Low vitamin D, and that's also common with multiple sclerosis. And also, they really are like, a lot of parasites are great at avoiding the immune system, right? Because they want to survive in our body. And so what they will do is to protect themselves, they might cause certain red blood, so they might infect one red blood cell, but they'll cause other red blood cells to kind of stick together to form kind of a flower shape, where rosette shape, where our white blood cells, our soldiers, are not able to get to the parasites or don't see them. Pardon me, they may not see the parasites. And also the malaria protists, the parasites that cause malaria, they can bury themselves into tiny blood vessels. And so I wanted to also talk about testing for malaria. Again, so if you have multiple sclerosis and you go through my blog post that we'll have up next week, and you have a lot of the symptoms, you've had a lot of blood work similarities, you may not have traveled to countries that have malaria, but maybe do a little bit of digging, you'll see that there is malaria in your country. And back in the 1920s and 30s, there were epidemics in the United States of malaria, and I never looked back for Canada, but back in the day, it was a lot more of a serious problem. Now it's more endemic, it's more of a low grade, and a lot of people aren't exposed, or if they are, their microbiome and their immune system is strong enough that they may fight it off. For myself, I was on months of tetracycline, which really devastates the ecosystem, which really puts you out of balance, which really makes it easy for different parasites to get a grip on us or to establish themselves in us very easily. So, as far as testing for malaria, different researchers have advised that, and this is what we would do with our students, is that you're going to be energy tested for, nowadays they're using something like hydroxychloroquine. And if you energy test well for that, and if you have a lot of symptoms, so your practitioner is going to be putting all of these symptoms together, your blood work, and then if they decide they want to treat or if they want to test better for malaria, then you would start treating and then look for the malaria parasites, because I don't know if it chases them out or what it does, but they were just able to pick them up a lot better. So that's really important. The way that they're treating malaria now is different than how they treated malaria in the past. So in the past, they would use quinine, or I think it's called hydroxyquinine. So those two. Now it's, even though they're using hydroxychloroquine, they're using it more of a maintenance drug. So, and I'm not sure if they're using it as a maintenance drug because it's not safe to use it for higher doses or not effective. But for people that have lupus or arthritis, they just will take it forever, basically. And that's not what we want. We want to recover, right? We want to get our health and our life back. So, in order to treat, and this is where, with the work that we do in the Live Disease Free Academy, we really see that it's challenging to get rid of these chronic, silent parasitic infections. It's really challenging. So, what we need to do is we need to just look for different angles. So, one thing that I found is that the CDC explains that artesunate is the preferred treatment for malaria. And I believe that that will cross the blood-brain barrier because it is used as, they're injecting it into you. And then to help the artesunate work better, there's something called garlic oil or pearl garlic oil. And the combination in studies, and I'll put that in our blog post also, the combination there, it really helped to clear the malaria better than just artesunate. So artesunate is an injectable form of the herb wormwood. And it's a type of wormwood called sweet Annie or artemisinin. And so they've made this drug form of it where they can inject it into you, and that will go more systemic, and it will be more effective, I believe, than hydroxychloroquine will. So hydroxychloroquine might give you some symptom relief. And I wanted to also mention, too, that back in the early 1900s, the doctors that were treating people with malaria and also people that had MS and they thought that they had malaria, that malaria was causing the MS, they noticed Herxheimer reaction. So whenever they would start treating somebody for malaria or MS with malaria drugs, they would notice that the symptoms might get a little stronger. But then shortly after that, the symptoms would be a lot better than they were before they started treating. So it's something that they acknowledged, that they noticed. They didn't know what it was. They didn't call it a Herxheimer reaction because they didn't know that. But it's something that if your doctor is treating you for malaria, that you really want to know or be aware that you may notice Herx reactions. And that could be why some of our students, they are super sensitive to different kinds of treatments at the beginning. And that's why all the prep work is so important. It really helps you to tolerate treatments better. So putting this all together, what some of the doctors, and this is putting some of the different blog posts that I put together, but basically, if we are infected with malaria and they are infecting our red blood cells, so then those red blood cells are not going to be healthy red blood cells. And then let's say we go through stressful periods of time. We have a chronic infection of malaria, but because we are, like certain times we're healthy and we're getting sleep and we're not too stressed and we're not eating bad, then we find that we are managing, we're living with it. But if we're eating a lot of carbs, we can have that lactic acidosis. We can have a higher amount of acids in our body, and that can impact our health in many ways, deficiencies in minerals, on and on. But the parasites can become more abundant because our immune system is not as strong when we're really stressed, or when we are, when there's different factors, our environmental factors are not right. So then our immune system is more suppressed by the malaria, by our lifestyle, by the environment. The malaria can reproduce more, infect more red blood cells, and then we can end up with these red blood cells that are not healthy. They can actually lodge into these small blood vessels that go into the brain. They can obstruct those blood vessels that go into the brain. And remember that around every blood vessel, like whenever you see a lesion in the brain, an MS lesion, the lesion is around a blood vessel. All right, so there's a lesion in the center of the lesion, or in the middle of it, there is a blood vessel. And what I shared on previous talks was that it could be that, you've got the parasites in your blood, and then you end up with, and you may have obstructed blood vessels in different parts of your body. You could get, broken blood veins in different parts of the body. But when it happens in your brain, and you get a capillary that breaks, and then you get this iron deposit, and that's found in MS too, and they're really linking that with malaria and with MS, and you end up with the malaria parasites right there around that blood vessel in the brain. So what's the immune system going to do? The immune system is going to go after the parasites. So if your red blood cells break the blood vein, and then some of those red blood cells, they fall apart, they're old, they're worn out, they have parasites in them, the parasites are released, then your immune cells are going to go after them. And so that will be the lesion. The inflammation is your immune system is, okay, we got to clean up. We've got a hemorrhage here. We've got a blood vessel that's broken. We've got parasites in the area. We need to clean up this mess. And so then what does our healthcare do, our standard of healthcare? They're like, oh, the immune system has gone haywire. Let's shut it down. And so we end up with all these lesions, and, it's not a coincidence that the lesions are always around a blood vessel. And so when you start looking at all of this evidence and you go, oh my gosh, my red blood cells are a little bit off. They're a little larger than normal. And that whole jaundice thing, like if you've ever noticed that you're a little bit more jaundice in the winter time or whatever. So you just start to see all of these different symptoms and coincidences that this is why these doctors were treating malaria back in the late 1800s and the early 1900s, because they saw all these similarities. They really believed that it was a very big part of MS for a lot of people. So we are going to put all of this information on a blog post. I really want to encourage you to share this with your practitioners and get them thinking. So I'm trying to think, because this is all, quite new, but kind of thinking like, you have to give them evidence to why you would think that malaria could be one of the parasites that you're dealing with. It's not going to be the only one, but it can be one. And so then you would show them a lot of the things from that blog post. You can just grab whatever you feel is with the blood work that you have, with the symptoms that you have, and then ask them, like, would you be willing to, and you can get energy tested for hydroxychloroquine if you test well for it. So then you've got the symptoms, you've got the blood work, you've got all of that evidence. And then if you test well for the hydroxychloroquine, then your doctor may want to put you on hydroxychloroquine on a safe dose. You should be monitored. I personally wouldn't take that drug by myself because it can affect your vision, and that could have to do with the malaria. I don't know, but you want to be safe. You don't want to wreck your eyes and other adverse effects. So, and then if they do give you some hydroxychloroquine, then they can measure and see if they can pick up any parasites. But if you have a lot of symptom improvements with the hydroxychloroquine, then you might want to be looking at also finding usually it could be a functional medicine doctor, it could be a naturopathic that will do injections and that can inject artesunate. And they can follow the CDC guidelines, which is right on the internet. But then I would take the pearl garlic oil orally while you're doing the injections of artesunate. So this is interesting, and I want feedback from you if you guys, because some of you are working with me, some of you will be working with me, and some of you are working with practitioners. So just give me feedback. Let me know if that turned out anything for you. I'm on a mission to solve this MS riddle. And if we solve the MS riddle, we'll probably solve a lot of other neurological diseases because they're all very, very similar. So keep in mind too that the neurosyphilis, it produces a lot of these similar symptoms as the neuromalaria does when we have the cerebral malaria, and neurosyphilis are very similar. And somebody was mentioning babesia also, and babesia is a protist. It's similar to malaria, and it has been linked with multiple sclerosis. So I just talk about malaria because that's what all the previous research talked about, but both babesia and malaria, they both infect our red blood cells. They have very, very similar symptoms, just as the bacteria that causes Lyme disease and neurosyphilis are very similar. And that's why many, many years ago, all of these researchers and doctors, they really felt that MS was a disease caused by spirochetes, like the Lyme disease, neurosyphilis, or caused by malaria, a protist type parasite like malaria or babesia. I think that these two play a big part. But then when you start digging more in the research, you see that, when you've had chronic malaria for a while, then candida can be a problem. And then also schistosomiasis, the flukes can be more of a problem. And I really believe that that's what's going on with MS is that, some people have intestinal flukes, but they don't have things like malaria or babesia or Borrelia. And we're just trying to find what the differences are. So what are my thoughts on the PS128 probiotic? I don't know that one exactly, Vicki. I don't know which brand that is. But what I do know is that if you're going to use a probiotic, make sure it does not have prebiotics in it, because if it has prebiotics in it, then the prebiotics will feed the parasites that are in your gut. And so we've had students that have shared that, if they took a probiotic that had prebiotics in it, it's usually some type of fiber. Avoid that. You can use different probiotics. You would want to do one that's dairy-free, obviously gluten-free. If you're in a country where they have genetically modified, you would want to avoid gelatin capsules and see if it helps you, right? You can, if you don't notice any difference with it, then I personally would not use that probiotic. We really like raw sauerkraut, especially homemade raw sauerkraut, because then you are really taking in diversity of different microbes that you don't even know what they are, but health promoting microbes that are amazing. It tastes really good. It's like a food. It's like a living food. Get into the habit of making your own raw sauerkraut. You can buy it at Costco, but it's not going to be the same. It's going to be a culture where there will be just 2 or 3 strains and there won't be a lot of different types of microbes in it. You're very welcome. So the bottom line is that there is a huge history of linking MS with malaria. The last part will be next week, where I'm going to talk about geographical locations, like the similarities in, like where they're finding MS and finding malaria. It's quite fascinating also. So we've talked about, the history of the evidence of the similarities between multiple sclerosis and malaria. We've talked about the symptoms, the similarity in symptoms, the similarity in blood work, the incredible improvements in people that have been treated for malaria that have MS, whether they were just living in the time where there was the epidemic of malaria in the US, or maybe they were just working with a doctor that felt that they would benefit from a malaria drug. it's quite shocking. If you didn't listen to last week's talk, make sure to go through that case study, whether it's you can see it written or in video form. But this lady, within just a few months, she went from not being able to really walk anymore and being quite disabled to being able to walk. She didn't do anything else. I still believe that if you really want to have like full recovery and have an amazing life, then you do want to make a few other changes and treat a few other infections. But it was life changing for her. So, and there is one research paper that I'm trying to get access to. It's archived for like from 1932 or 35. So it's a little bit tricky getting it. But I hope that this shows you that there is a cause for what you're dealing with. When you're diagnosed with MS and you're told that there's no hope for you, you're going to end up in a wheelchair, but the drugs hopefully will slow things down. The drugs, the MS, disease-modifying drugs, make us weaker. They suppress our soldiers. So when we have infections like malaria and we're suppressing our immune system, we can expect that other parasites are going to move in and cause other diseases. So yes, after a few years on these disease-modifying drugs, we can have MS and diabetes, cancer, epilepsy, inflammatory bowel disease, arthritis, you name it, 3 to 5 diseases easy, at least 3 diseases in time, because we're making ourselves weaker, we're making ourselves more susceptible to other parasites. So if you are done with that, you've tried these parasite drugs, if you've tried the MS disease-modifying drugs, you've been down that path and you're finding that you're just becoming more and more disabled and you are not living your life, you're not doing the things you love to do, make sure to watch my masterclass training because it explains all the steps on how I recovered and how wellness champions are recovering right now and how many hundreds have around the world. So watch that. You'll know all the steps. If you need support, if you don't have support, make sure to reach out, fill out the form, book a time to chat with me. You can become a wellness champion. If you want to hear their stories, if you want to hear the successes of other people, make sure to go on to livediseasefree.com. Our website, there's a lot of successes there. We're at least 8 years where our students that have taken the program 8 years ago, they are still symptom-free. They're living a full life with no MS drugs. And then we also have them on our Live Disease Free YouTube channel. So with that, I hope that you enjoy this information, that you find it helpful, not even enjoy it, but find it helpful that, oh my gosh, there is a reason why you're so sick. There is a reason. And it's so important that you use the right treatments for the type of parasites that you have. So if you have blazing, like really active malaria, and you do have some roundworms, but you treat those first, you might feel worse because you're not really treating the parasite that's causing the strongest symptoms. Or if you're treating Lyme disease or Babesia first, but you have a lot of tapeworms or roundworms or other flukes, then you're going to find you can be reinfected with the smaller parasites. So I don't know, and that's another thing I'll look more into with malaria. We can get them from mosquitoes, but could we also get them from ticks? And we know that we can get these filarial worms from mosquitoes, from ticks, from all kinds of biting insects. We can get Lyme disease. So we can get different types of microbes, and we have to make sure we treat all of them if we really want to live an amazing, full, healthy, active life. So with that, I hope you have a wonderful week, and we will talk to you next week. Take care and bye-bye for now.